Hey, I want to thank you for joining us on Polk Place. I'm Brian Lacey, and joining me in studio from the Polk Health Care Plan is Holly Vita. Welcome to the show.
Hi, thank you so much for having me.
And you still got that new employee, smell about you.
I do. I'm 3 weeks in.
But you are a veteran of the Polk Health Care Plan. Talk to me a little bit about your history with it.
Well, I was privileged enough to be able to serve on the Citizens Oversight Committee for 6 years, many years ago.
Yeah.
But I have had the opportunity to come full circle, and now I actually work for Polk County government as the Behavioral Health Program Manager.
And going to give us a brief overview of the Polk Health Care Plan. There's some changes coming, and within the Polk Health Care Plan, we might be able to help them, right?
Yes, absolutely.
So for those that might not know, what is the Polk Health Care Plan?
The Polk Health Care Plan is our safety net program for our citizens that is paid for through our half-cent sales tax. And it actually serves as a program for those who are eligible. It gives them health care coverage so that they can see primary care providers, specialists, including behavioral health.
Mm-hmm. Now, there are some changes that could be possibly coming to Medicaid. Let's talk a little bit about those and how we might be a safety net for that.
Yes, absolutely. So during the pandemic in Florida, everybody who was eligible for Medicaid remained enrolled in Medicaid. Right now they're going through the process where they are revisiting those who are eligible, and so some people who have been covered through the pandemic may no longer be eligible for Medicaid. And so the key here is that some of those people, and these are really our most vulnerable citizens in Polk County, those people may be eligible for the Polk County Health Plan, which is great news.
When you say they're vulnerable, talk about the importance of the plan itself, rather than deep into a problem. It's helping, say, discover diabetes at an early stage, anything along that lines. Talk about the importance of catching something early versus catching something late.
Absolutely. So making sure that we are visiting our primary care providers so that any of that lab work can be done. Diagnostic tools are available to those on the Polk County Health Plan, so that if you are experiencing a healthcare issue, those things can be diagnosed very early and then can be treated, and things like prescription drug coverage, all of those things come with the Polk County Health Plan. Polk Health Care Plan.
Talk about some of the things that the Polk Health Care Plan covers.
Absolutely. So some of the items, things like urgent care visits as well as emergency room visits, those things are eligible under the Polk Health Care Plan. And then specialists. So talking about seeing specialists so that if you are diagnosed with something, you are eligible to go and see specialty physicians who can help you through those processes. So one of the key items that Polk County Health Care Plan members are actually eligible for is behavioral health. And I think that during this time, post-pandemic, we've seen an increase in our residents who feel like they're experiencing, mental health and mental wellness issues. And so the key is that Polk Health Plan members actually have the opportunity to visit behavioral health specialists in our county.
I want you to talk to me a little bit about how folks can get involved with the program. What's the easiest way? Do they call? Do they come in? What's the process to become part of the plan?
So very easy, 533-1111 connects you with a case manager who would be able to get you signed up, or you can also visit the Polk County government website as well, and it will link you to the Polk Health Plan.
We got just a few minutes left. What I want you to do is, losing medical coverage can be something that is really difficult for someone and the paperwork involved, inspire those to make the call, inspire them to, don't give up. The Board of County Commissioners, the Polk County Health Care Plan is there to help them, inspire them to get involved, if you would, please.
Absolutely. So I think that the key is that they have time. This isn't something that's going to happen overnight. They are going to be reviewed for eligibility, and if they do discover that they are no longer eligible, there are case managers ready to have appointments with them, talk them through the process with Polk Healthcare Plan, and get them involved quickly. And it's really a very easy process, and they have the opportunity to get healthcare coverage almost seamlessly.
Well, Holly, it's always a pleasure to see you, and now that you're one of us, I fully expect you in here. I will always want to talk on how we can help the residents of the county achieve their medical goals. And come back and see me again, will you please?
I would love to. Thank you so much.
The Polk Healthcare Plan offers Polk residents access to health care. The plan is not insurance, and members do not pay annual deductibles, monthly fees, enrollment fees, or submit claim forms. Members only pay small copays for doctor's visits or filled prescriptions. The Polk Healthcare Plan partners with licensed medical providers in the community to connect Polk residents with the care they need. Now, for community healthcare resources other than the Polk Healthcare Plan, please call our customer service line at 863-533-1111 or look them up on the web at polk-county.net for more information.